Hi there, it's Dr. John Rogutsky with New Life Physical Therapy. Today I'd like to show you a few of our quick hitter exercises for hip joint. That could be if you have some hip stiffness or groin pulls or a little bit of buttock soreness or something like that. So first off, what we're going to do is just something really simple that we use a lot is just a hip rock. So I've got my hands on my hips to help kind of move things, and I'm just going to do a little side to side sway going here. A lot of people have surprising difficulty with that, just moving side to side. Now I'm going to throw my hips into just a little bit of rotation, getting them to twist and turn, using my hands to help. And then last I'm going to do just a little sit back and push forward, sit back and push forward to take them forward and back. Here's a side view. As you can see, I kind of tuck my hips in and then stick my butt back a little bit. Next up, we're going to stretch the front side of the hip flexor muscles. A lot of times we see tightness in through there. A step stool might work well for this. Sometimes standing near a wall or standing in a doorway is a great place to do this. I'm pushing my hips forward to try and stretch the front of that hip joint. My back foot is going to stay flat and my knee stays straight. If that's easy, then I can move up onto a higher surface like a chair or a stair step, and I'm pushing forward from here while staying straight and anchored in through this position. So we just did some stretching through there. Now we want to reinforce that with a little bit of strength. This is what we call hip loading. I'm going to get in a staggered stance, and this is for this left hip here, and I'm going to reach a surface down and forward. This chair back or a countertop works well, causing myself to rotate and kind of wind into those hip muscles a little bit. Really great way to stimulate those hip muscles to engage for you. Then lastly, what I'm going to do is a little bit of a sit back squat. You can notice my hind end goes really far back behind my heels to load up my glute muscles, my buttock muscles, and kick them in so they engage really nicely for me. So there was a quick hitter, a few series exercise with some stretching and a little bit of follow-up strengthening for the hips. As always, if you have any questions, ask your New Life Physical Therapist. Otherwise, take care, be well, and keep moving.